Hello, this is Abdul Fatah, and today I am going to describe in front of you the my created slides as per my research. I have researched three articles on this basis. I have created this PowerPoint. So I am going to describe about the IV cannulation. So my topic is IV cannulation in the researcher's eye. So first of all, I would like to tell you about the objectives that what I am going to tell you. So first one is the indication of the IV cannula. So IV cannula is the basic procedure in every hospital and clinic. So through this one, we can transfuse the blood, we can give the medicine. And second one is objective is contraindications of the IV cannulation. If not IV cannula, then what? So one by one, I'm going to describe you. Indication of the IV cannulation. So when you are going to pass the IV cannula, what you need to be have information about the repeated blood sampling, IV administration of fluid, okay, and IV administration of medication, chemotherapeutic agent, and nutritional support, and furthermore about the blood and blood products transfusion. So these are the indications, the basic indications of IV cannula procedure. So what are the contraindications of the IV cannulation? So first one is the sclerosis of vein. When there is sclerosis means hardening of the vein, means already there is a prick of the IV, so there will be obviously the hardening of the vein will happen. So in this case we cannot pass the IV cannula. In IV infiltration, infiltration occurs when IV fluid or medications leak into the surrounding tissue. So here is the example of this one. I have mentioned burns. While there is any kind of burn like first degree burn, second degree burn or third degree burn, you cannot pass the IV cannula at that site. The extravasation is the leakage of a fluid out of its container into the surrounding area, especially blood or blood cells from vessels. This is the condition when we are passing the IV cannula. This could be happen. So, and other one is a traumatic injury proximal to injury site. If there is any kind of injury where you are going to pass the IV cannula, then you cannot pass at that site. The arteriovenous fistula. This arterio IV fistula mostly we are making in the dialysis patient. So if there is any kind of IV fistula, you cannot pass the IV cannula. If not IV cannula, then what? Instead of IV, we can use ETT, endotracheal tube. By endotracheal tube, we are mostly giving the medicines, okay, like epinephrine, like naloxone, we are giving that. Intraosseous route. Intraosseous route, we are mostly applying when there is no IV access, mostly in emergency cases. Oral route, if conscious, otherwise by OG, orogastric tube or nasogastric tube. Then after the big one procedure is central line. If there is a central line, okay, if there is no IV cannula, we can pass the central line, Hickman line or Pickman line, Pick line, right? And what is my experience after researching the uh, articles? Experience based opinion is, in my point of view, every junior and senior staff, either he she is in governmental hospital or private, they need to have a single IV course. Means everyone have a single IV course and they need to be um, competent in the practice, in which theoretical and practical hours should be included, and at the end everybody will have to be certified. The certificate must be valid for the 1 year or 6 months, and after expiry the certificate should be renewed. The conclusion of the article: first article I reviewed, and after that I got the conclusion, which I have mentioned here. The conclusion is proper technique, equipment, familiarity with anatomy, and a knowledge of a variety of approaches to accessing a peripheral vein. So, familiarity with anatomy means where is a brachial or radial or saphenous vein, you need to be familiar with that. And knowledge, you should have the knowledge of the procedure. Is it a sterile procedure? Is it a clean procedure? Right? And second one article, which is a researcher's point of view and the article's conclusion. In this research article, the researcher has mentioned about the pediatric cannulation. In this research article, I have seen that the pediatric pediatric researcher have researched in the NICU, and he made the article on that base. So cannulation difficulties and frustration feeling, which mostly happens due to inadequate practice and education, which could be solved by continued education. So there must be the continued medical education and diploma, whatever seminars and other things should be conducted. So what is being used in the above article? In the second article, the researchers has used the research design. A descriptive research design was utilized in the current study. The tool was a structured questionnaire sheet and a scoring system, observational checklist, pilot study, and the field work used in that one article. So the third one article's topic was reducing complication of IV cannulation. The conclusion to prevent the complications related to IV cannulation and increase the duration of stay of IV cannula. So duration of the IV cannula mostly that's 4 to 7 days. So we need to increase the duration of stay. The training of personnel working in NICU. There should be the training prior to procedure. Irrespective of experience is recommended. Experience is most recommended. So what are the APN roles? As I am a APN, advanced practice nurse. So what are my roles in this one? And what are the nurses' role? So nurses' roles are already described that they have knowledge and they need to be practiced in a sufficient amount. The APN ANP is a collaborative worker who helps subordinates during practice and increase their knowledge by sharing experience. So CME continued medical education must be handled by the ANP. ANP should research by using a different kind of methods of research to fulfill the gaps in practice. So this is the PPT which is based on the research article which I have shared with you. In the next PPT, I will share you another topic and you will enjoy. If you like this video, please subscribe and press the like button.